So what are vaccines? Vaccines are given to protect a child from that particular disease. We inject the same bacteria in an inactive form and let the baby develop his or her antibodies. What are the typical vaccines given at birth? So we give BCG. Now BCG is given to prevent a child from getting tuberculosis. BCG is given on the left arm, and we have to see a scar formation after 6 to 8 weeks. Now BCG is not 100, it doesn't give 100% protection, it just gives 50% protection against lung TB. All other tuberculosis, it gives lesser protection. The second vaccine which we give at birth is hepatitis B. That's given typically on the thigh area, and there are 3 doses to be given. So BCG, hepatitis B and oral polio. So these are the 3 vaccines to be given at birth. So after BCG, hepatitis B and oral polio, all other vaccines are starts to be given at 6 weeks, 10 weeks and 14 weeks. That's 1.5 months, 2.5 months and 3.5 months. The set of vaccines which you give at 6 weeks, that's hepatitis B, HIV, which stands for Haemophilus influenza B, DPT stands for diphtheria, pertussis, tetanus, and IPV stands for inactivated polio vaccine. So we repeat the same vaccines at 6 weeks, again at 10 weeks and again at 14 weeks. Now, many of my patients ask, doctors, there is something called as painless vaccines. What's the difference between a painless vaccine and a vaccine which causes pain, fever and swelling? Now imagine an apple with the skin. So we divide the bacteria. So in DPT, the P part, that is the pertussis bacteria, has a covering. So with a special technology, they remove the covering and hence it is called as acellular. The covering is what reacts with the baby's body and causes pain, fever, swelling. So the painless vaccine is called as acellular vaccine, whereas the vaccine which causes more pain, fever and swelling is the one which is called as a whole cell vaccine. That's because the vaccine is given, the entire bacteria is given along with the cell covering. Now which one is better? So studies have proven that the whole cell is definitely better, gives more immunogenicity to the baby than the acellular vaccine. But if you want to differentiate the two, you can have best of both worlds. You can opt for painless or the acellular vaccines and make sure that at least 2 doses, whether it is at 1.5 years or at 5 years, you give a whole cell vaccine.